Hello there, my name is Tyson, and I'm here to welcome you to atrioventricular blocks. Atrioventricular blocks, or AV blocks, are often talked about in EKG reading and cardiac monitoring. You might have even heard of one or more of the four types before. You see, the medical field rates these blocks into different degrees. You have a first degree, a second degree type 1, a second degree type 2, and a third degree. They're rated into the degree area based off of their severity. Now this video is going to break down AV blocks as simply as possible. We'll address them into three major points, starting with what are AV blocks? Then we will identify what the different AV blocks present like, and end it all off with the etiology or possible causes of AV blocks. Are you ready? Let's get started. So first things first, what in the world are AV blocks? AV blocks are a malfunction in the heart that interrupts impulses traveling from the SA node in the atria into the AV node in the ventricles. It's easy if you think of these as progressively worsening roadblocks put up by the police. They either slow cars down, the cars being our impulses, down that street or our conduction pathway, or eventually stop them entirely. This causes a disconnect between the atria and the ventricles contracting, which can hurt our heart's ability to pump blood effectively. Now let's take a look at what our AV blocks present like. We'll start off with our first degree block. This block is a pretty weak one. It only slows down the conduction of the SA to the AV node a little bit. You can tell a first degree by its PR interval lengthening. It will measure about 0.20 to 0.44 on an EKG strip. Otherwise, the rhythm looks completely normal to whatever its underlying rhythm is. Now when I say that, I mean that this block is dependent on another rhythm, meaning that when you identify it, you say the normal rhythm and then add the block onto the end. An example, you might have a sinus bradycardia with a first degree block. Now, onto the second degree. There are two types, or Mobitz, of second degree AV blocks. The second degree, type 1, or Mobitz 1, is also called a Wenckebach. This appears on an EKG as a progressively lengthening PR interval until the rhythm drops a QRS complex. Now, if that doesn't make total sense, with our analogy we used earlier, our roadblock is making cars wait longer and longer until one gets stopped completely, or can't create that QRS complex. The other type of second degree does a similar action, but goes about it a little bit differently. This block appears to be a sinus rhythm for the most part. Now it can be slow or have a slightly lengthened PR interval, but that's unusual. The big thing for this block that makes it different than any other rhythm is that it drops QRS complexes intermittently. Now in our analogy, our roadblock is letting most of the cars through as normal, but every once in a while it stops the car from getting through. Now that we've gotten both of the second degrees and the first degree out of the way, let's get into the worst of them all, the third degree. The third degree block has a complete disconnect between the SA and the AV node. This roadblock, in our analogy, is blocking anything from going through, so that cars cannot get to where they are going, and the heart on the other side is trying to function without that stimulation. This results in the P wave, or the atria, consistently acting of their own accord, completely separate from the QRS complex, or the ventricles, which is also acting in a wide ventricular rhythm completely by itself. The third degree, because of this, is the most detrimental to our patients out of the four blocks. So now you know how to identify these rhythms and generally how they work. But what really causes an AV block? As we said earlier, AV blocks are just interruptions in the conduction pathway of the heart. And a lot of things can cause it. Starting with a past myocardial infarction. This is one of the bigger causes. The tissue that dies can't conduct as well as it could before, or really at all for that matter. Along with an MI, you have hypoxia or ischemia, which can eventually lead to an infarction and definitely cause dysrhythmias. Another thing that we can think about is prolonged illicit drug use. This can be very detrimental to the body as a whole, but it definitely causes an overworking of the heart and a breakdown of its ability to function correctly. Then we get into some of the several diseases, such as sick sinus syndrome, that can cause a disrupt in our conduction. And last, we're going to end it all off with the stimulation of the vagus nerve, which depresses our cardiac center in general and can cause a lot of different dysrhythmias, issues, and problems with conduction. Recap! Okay, to recap, we went over that AV blocks were really just interruptions in the normal conduction pathway of the heart. And then we got into what these different blocks look like. We used a roadblock as an example. The first degree just slowed those cars down. And then we got to the second degree, type 1, which slowed the cars down worse and worse and worse until we lost one. He didn't get through. Then we got to the second degree, type 2, which let cars through normally until randomly deciding to stop one. Then we ended it off with the third degree that totally blocked off any communication between the cars and where they wanted to go. We ended this video off with telling you the causes of AV blocks. We told you about MIs, ischemia, drug use, disease, and vagal stimulation. Okay everyone, that wraps up our video on atrioventricular blocks. I hope this cleared up any confusion or maybe mental blocks that you might have had about this subject. If you like this video and you want to see more rhythms, follow the links below for more awesome and easy to follow videos on EKG rhythms. And I'll see you there.